Hello, everyone. Can you hear me? All right, so we will start in another 1 minute. I hope everyone is prepared. Thank you. Bismillahirrahmanirrahim. Assalamualaikum and good afternoon to our honorable panelists, Dr. Lihanna, Miss Masturah, Miss Farhana, and to all participants. Welcome to What Has IIUM Done to Manage Students' Mental Health Forum. First of all, let's get to know the speakers we have for today. First, Dr. Lihanna, the Director of the Knowledge of Change and Advancements. Some of the office functions include promoting strategic cutting-edge education process and framework, coordinating and overseeing processes for quality assurance of academic programs, as well as liaising with relevant external agencies, including the Ministry of Higher Education. Next, we have Ms. Masturah, a respectable mental health officer within IIUM very own Counselling and Career Service Center, CCSC. And lastly, we have our beautiful Ms. Farhana, a mid-COVID student leader under Psychology Student Association, SACSTA, within the Kuliah of Psychology. We extend our warm welcome to all admirable listeners that are willing to share your time for today's event. It is our pleasure to have all of you here gathered with me, Shafika Alisha, your moderator for today as we discuss what has IIUM done to manage students' mental health. Thank you for spending your time with us. Also, to the listeners, if you have yet, don't forget to fill out the attendance form that will be provided in the chat box. Before we begin, I would like to invite all the Muslims to recite Kitab Al-Fatiha for victims of the recent floods in Malaysia as well as victims of COVID-19, and hopefully it will help in giving clarity and ease all our today's journeys as well. Amin, amin, ya rabbal alamin. Without further ado, let's begin. Assalamualaikum, Miss Masturah. Are you here?
Yes,
Yes.
Waalaikumsalam warahmatullahi
How are you?
wabarakatuh.
How are you doing today, Miss Masturah?
I'm good, I'm good. Uh,
Alhamdulillah.
just call me sister, it's okay.
Oh, okay, okay. I will call you sister. Okay, if you're comfortable with it, I will call you sister. Thank you,
Yes, yes.
sister, for being with us today. As we might know, COVID-19 has severely impacted people's mental health, right? We
Mhm.
could say this as the mental health hotlines such as Talian Kasi and Befrienders did indeed get an increase in the demands. So bringing it back to the case of IIUM, because we are discussing on IIUM, right? The
Right.
question is that, Miss Mastura, sorry, Sister Mastura,
Mm.
was there a spike in case of student approaching the CCS during COVID era compared to pre-COVID? Is there any changes?
Right, so Bismillahirrahmanirrahim. Thank you, Miss Moderator, Shafika, and then Prof. Lihanna, and also my other panelists, which is Sister Farhana. Thank you so much for inviting, and also thank you so much for the question. So to be specific, in terms of statistic, if you want to capture based on our system, you know that all of IUM students, when you want to book for a counselor, you have to go through iMaklum and then find your counselor and then book a session, right? So from there, we capture a statistic. Okay, so in terms of statistic, there is no significant increase, so much that we can say we have the spike in numbers. However, the intensity and then the complexity of the case, yes, that I agree, it has increased. Okay, meaning to say that the issues that we have during the first PKP and then until now, the issues are much more complex, multifactorial, and it's not a one-way solution.
Sister
As
Masturah,
compared
if
to
I
PKP.
may interrupt, you
Mhm,
said about the there is a changes and intensity, right? Can
mhm.
you share a bit, maybe in general way? Is there any changes or is there any factor relating to the spike in cases, right? Let's
Mhm.
say before this, the cases is mainly because of family problems, or maybe now it's because online learning. Is there any cases like that?
Yes, definitely. I mean, previously we also have clients with family issues, definitely. But what makes it different and more intense as compared to before COVID era, I would say, in terms of previously, our clients have different types of coping mechanism that they can apply. You know, they can do hobbies, they can do as other things to mitigate whatever issues that they have, and then they come for a counseling session for another mitigation approach. But when COVID's come, it start to become a barrier to them. They cannot do some sort of coping mechanism that they always use. And then when we have the lockdown, people got stuck inside the house, whereby maybe the issues come from the house, the parents itself. So the situation becomes more complex and intense, in which that our clients don't have any possible revenue or resources to mitigate the issues that they have in a healthy way.
Yeah.
And then of course, during the crisis period, most of the cases that we have is based on crisis situation, in which when they have issues, they call our numbers. And then sometimes it's just a brief session because they are in crisis. And then other times we need to have a more frequent follow-up sessions. So the number of cases might not be that increased because we use different platform. Most of our clients prefer face-to-face, but then we change to online, right? Because PKP, definitely. So most of the clients have less preference towards online, so the numbers it's not that significantly high. But in terms of follow up, we have more frequent follow up sessions. So we have different situation here, before COVID and after COVID. Mm.
So you talk about the more follow up, right? I
Mhm.
think it's quite overwhelming for the counselor as well. So what in what ways the methods and the coping mechanism that CCSE has to change to adapt to the situation with this online counseling? Is there any new methods or new programs that help?
Right, right, definitely. The first thing when we, when we are dealing with this COVID situation, I think everyone need time to really digest and start to think how to operate effectively. Okay, we did brainstorm in so many ways. We did come up with, okay, how about we just publicize our personal numbers, and then we come up with, okay, how about just emails, and that, etc., etc. There's a lot of brainstorming happening until the middle of the night just to find ways on how to offer the services in a effective ways. So lastly, we made a decision that we use Skype. Okay, so student can still book through iMaklum, but you will have to install Skype, etc. And so much so that because Skype is something that we can have history, and then we can voice call at the same time, we can video call if necessary. So at that moment, we decided to use Skype as a platform, because sometimes students do not prefer to have visual like video call. So if you use Google Meet, so there is a tendency like this one, right? We have a video call session instead of chat. So we use Skype so that our clients still have options and alternative. for them to express themselves. Some of them prefer chat, some of them prefer voice, and others prefer video. So using Skype is at that moment is the best way that we can offer at least three alternative way for our client to express themselves.
Yeah,
And in terms of
that's very convenient, right?
yes, in a way. So in terms of the way we are approaching the session, more or less we need to make some adjustment because we are using online medium. So definitely we cannot use some physical intervention, but however, when we use video calls and then we can interact more and then we can do activities in real time session, so that helps at the same time.
All right. Mhm. Thank you so much, Sister Masturah, for that enlightenment. Moving on to our next panelist here, we have Dr. Lihanna. Welcome to IIUM Virtual. I would like to first thank Dr. Lihanna for joining us today. And Dr. Lihanna, since we have discussed about the CCSC what they have contributed in terms of the policy creating for the whole university within the tragic COVID-19 era, as well as the recent flooding, what policy has been established to aid the student as well as lecturers to adapt to the change of teaching and learning settings. Can you share with us?
Sure. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Sister Shafika, and thank you, the rest of you, for organizing this and for inviting me. Before I answer that question, let me just also convey Tan Sri's salam. You invited him, right? And then, but he is actually supposed to be away, sitting with the vice chancellors. But he is now on campus. You know what is happening on campus right now. But here I am. So going back to the question, when we were all caught unaware with the COVID-19, we had the MCO where we only had a few days to actually get ready for the first MCO. You can recall in March last year, and immediately, of course, there were meetings upon meetings upon meetings, like what Sister Masturah said just now. We needed to take care of all the things, the academic part, but also the mental health part. Everything was taken into account. So we did have a few policies that were established right away. The first one was the emergency remote teaching and learning. If you remember, or for those of you who are only first year students here, we did not immediately change into the remote learning. Unlike most other universities, instead, we had a prolonged break. We gave an early midterm break and it was prolonged so that we could train our lecturers to be on the technical part, on the remote teaching and learning, and also actually included in that were also training of the students. Even though a lot of you are very familiar with gadgets, but when it comes to some of the things that we use for teaching and learning, remote teaching and learning, it took a little bit of training. Okay, of course, now everybody knows how to Zoom, how to do Gmeet and all that time. But when we first started, those were a little bit of a foreign language for some of us. Okay, so we did that. So we had that policy. And then if you remember, there was also the study leave policy where students who felt they were affected, no question asked on what is the reason, but they think they needed to take study leave, even though it was the middle of the semester and things like that. No question asked. You can take the study leave with no financial implication there, and also no, it's not going to be counted in your length of study. Okay, so we had that. We call that the COVID leave. And then if you recall, we moved the academic calendar to make it a bit more amenable, but at the same time, we also had to take care of the internship policy. So there were a lot of things going on with making sure that our students, everybody can go out for the internship, whether remotely or or on site. So these were negotiations being done between the universities and the various industry members to enable our students to go out and actually do internship so that they could graduate. Okay, and then we also have you can drop courses after you get your marks, if you remember that one. That semester, that first COVID semester, if you're not happy with your marks, you can drop those courses. Not anymore. Okay. And then we also change the minimum load requirement from 15 to 12, and you will also be able to actually qualify for Dean's List with 12 credit hours. Previously, you need to carry a minimum of 15 credit hours. And okay, that was taking care of the academic part. So those were the things, because regardless of whether we want to think about, well, but what about mental health? We're talking about mental health here, but we need to take care of how you can proceed, okay, how your academic activities are not going to be affected in the long run, because that is also going to affect your mental health. But then at the same time, we also established the IIUM Special Mental Health Task Force, of which I was the chairperson. And one of the things that came out of that is the IIUM Mental Health Policy for Students. If you're thinking, we have a mental health policy for students, that's okay. I'll talk about that a little bit later when we come to a different question. So those are a lot of policies that we established during this COVID era.
All right, Dr. Lihanna, thank you so much for that. It makes me realize that there's so many policies, and it shows that IIM actually care about their students. So, I can be a little bit confused here. So,
No,
let's separate the old policies and the current policies. Okay, so is there any policies that still in use and that still are working right now? Can you share with
okay.
us?
The one that is currently in use right now is, we no longer call it emergency remote teaching and learning. Okay, but now we have the remote teaching and learning policy. Okay. So this is going to go as we move along. Instead of going back to the way things are, we want to push for blended learning. Okay. It seems such a waste to really not use the skills that both students and lecturers now have on remote teaching and on the remote platform, on the virtual platform. But you also know, and I as a lecturer know, that I so want to meet my students face in person now. Okay, we miss you. Whether you, I don't know whether you miss us or not, but we miss going to class and
Of course we do. Of course we do. Of course
and
we do.
really working with our students. But but not so that's where we are. We do have now this remote teaching and learning going for blended learning. So it's going to be hopefully, once everybody come back in full, we're still going to have a hybrid kind of situation. Okay, and taking in what is good about each different ways of teaching and learning. Okay, we still maintain the minimum load policy. So even though we're no longer in the emergency phase, you're still going to only need 12 credit hours to maintain good academic standing, and also to enable you to get the Dean's List. Okay, so you don't really have to carry an extra load to get the Dean's List. So that is still in line. And of course, we're going to go into full force for the IIUM mental health policy for students. Okay. I'll discuss the provisions that are available for students later in that policy.
All right, thank you so much, Dr. Lihanna, for that. Moving on to our sister Farhana, Miss Farhana. Assalamualaikum. How have things going on these days? How are you?
Waalaikumsalam. I'm doing great, Alhamdulillah. How are you?
Yeah, I'm doing great despite all the deadlines. Okay.
Alhamdulillah.
Now that both Dr. Lihanna and Miss Masturah have discussed the perspective of the CCSE as well as the office, we would like to know, as a former head of Sexta IIUM, is there any program that is associated conduct regarding mental health towards students, and how do you see the effectiveness of those programs?
All right. Okay, thank you so much, Sister Shafika, for the question. Before I begin answering the question, I would just like to mention a little bit about SpsychStar, or it's actually Secretariat of Psychology. We used to be Psychology Students Association, but we have changed the name to Secretariat of Psychology as a standardization for all secretariats under AHAS KHS. Okay, so a little bit about SpsychStar. So SpsychStar, as you guys know, is a department-based society under Department of Psychology. So one of our missions, other than becoming the student body or the liaison or medium between the students and the department, we also have a mission to empower student programs and student development, focusing on the niche or area of specialization of what we learn in under the Department of Psychology. So definitely most of our programs, if not all, focuses on the application of psychology knowledge. And mental health, as we know, encompasses many things, emotional well-being, social well-being, psychological well-being. So the application of psychology is important in addressing mental health issues and awareness in society. And to answer the question whether we have programs focusing on mental health for the students, I would like to highlight on one program that we have for tonight, which is Peer Psychosocial Support Team Project. And I believe some of you may know, especially AHAS KHS students, and some may not know yet if you are not from Kuliah of AHAS KHS. So perhaps this is a good time for me to introduce what peer is about for those of you who do not know
Yes,
what
please
it
do.
is.
I
Yeah,
don't know
okay.
what it is.
Oh, you don't know what it is?
I
Okay,
don't
so
know what
it's a
it
good
is.
time for me to
Please share.
introduce then. Okay, because peer is still ongoing. The long name is actually Peer Psychosocial Support Team Project, but I'm just gonna mention it as peer throughout the way, okay? So peer is an initiative to assist the mental health needs and well-being of AHAS KHS students in response to the alarming rate of mental health issues among students in light of the COVID-19 outbreak. So peer is an initiative that came after the COVID-19 outbreak. And how peer works is we have psychology students who undergo trainings, multiple trainings actually, with professional clinical psychologists under the department, such as you guys may know Dr. Pamelia, Madam Aini, Dr. Jamila. So they are the academic members of the department as well as professional clinical psychologists. So our volunteers who are among psychology students, they undergo trainings with them. Undergo trainings before proceeding to have a session with students. Okay, so how it works is we open a registration for the students to have a one-to-one session to talk about anything at all, about their personal concerns, academic worries, anything at all. And we ensure privacy and confidentiality between the peer volunteers and the students. And what's so special about peer is, even though we are not professional therapists or professional psychologists, but we are using resources within our capability and what we can offer as students to provide accessibility to the students who need someone to talk to, but may find it difficult to find someone to talk to. People can talk to their friends. People can talk about their problems, their worries to their friends, but sometimes friends may invalidate our feelings, our emotions, or not really listen to what we have to say. So our peer volunteers, they are trained with heart-centered listening. One of it is heart-centered listening, which is based on 4 principles of love, LOVE, which is listen, observe, verify, and empathize. So they are trained to give attentive listening and heart-centered listening. And best believe how talking to someone who actually listens can do so much to a person's mental and emotional well-being. So what we do is we have done this for 3 semesters now, and we open registration to the students. Even right now, it's still ongoing, but we only open for AHAS KHS students at the moment because we do not have enough resources to offer to the entire IIM students. So we reach out to as many people as possible, and we try to assist them with their mental health needs and well-being before it gets severe. And I would also like to add on peer, and the process of peer is, first of all, when the students register, they will have to go through a screening session. Okay, so the screening session, if the problem the students are facing are severe, then they will be directed to the right sources such as CCSC. Like Sister Masturah is from CCSC, so such as CCSC as well as Impact. Impact is IIUM Mental Health, Psychosocial and Care Team. And then for the students who are their problems are less severe, such as they don't have any suicidal thoughts and so on, then they will be assigned to our peer volunteers, where they will be having a one-to-one session to talk about absolutely anything. Um, and then that's one of the programs that we have in Staff, because I believe that all of our programs, most of our programs are related to mental health, because we focus on the niche of our what we study, of our specialization. And then I would also like to add that we are so used to mental health webinars. There are so many mental health webinars. Even us, honestly, even as Staff, we handled a lot of webinars, and they're definitely useful and eye-opening. But I think we also need to start talking about accessibility. People are now aware of their mental health issues, but we need to talk about accessibility. How can they get the help that they need? Okay, so this is one of the things, this is one of the initiatives that we offer to our students about accessibility and how they can get the help that they need. So yeah, but I would also like to add that peer psychosocial support team is, even though it's only for our high scale KHS students, I believe that it still needs larger exposure, and it needs to reach out to as many students as possible. It has been going on for 3 semesters now, and if you are from a high scale KHS, which I believe most of you are, I would like to promote peer psychosocial support team. The registration is still open. You can go to our profile on Instagram or Twitter, where you can type peersupport.iium. So you can find more information there. We also post infographics about mental health, about heart-centered listening, and so on. So yeah, that would be one of the initiatives that Sexta is doing to help the students with their mental health.
Thank you so much, Sister Farhana. I mean, wow, that's new to me, That's very new to me. And I think it's very eye-opening as well. I think if other kuliah, a person from other kuliah listening to this, I think we can do, in larger scale, because it is a need, right? Because mental health has become an emergency, especially with the COVID and flooding as well. So yeah, that's a good initiative. Thank you so much for involving in that. All right, so moving on to our next panelist, Ms. Masturah. Through the data and news article, we could clearly see that COVID has certainly affected people's mental health. But let's dive a little bit into the ways of COVID has affected people's mental health. So, in what way has the COVID-19 pandemic affected people's mental health, and why it is such a pain for mental health? I mean, we know in general that COVID-19 pandemic definitely affected people's mental health, but in what way actually?
All right. Sorry, there's azan here. But I just continue. Okay, so when we talk about COVID and mental health, definitely in one way or another, someone's or an individual's mental health might be affected. Okay, in some way or another. Some might be so intense, some is not that intense. Okay, some, the situation in which that they already have pre-existing condition, so COVID-19 is just escalate the condition, right? For the others, they may have a very stable mental health, but suddenly crisis hits them. So their response to the crisis leads to the disturbance in their mental health. Okay, so the most instant observation that we can see how people mental health affected by this COVID-19 is where people lost their sense of control. They lost a lot of things that they can control. So if previously as a staff, I'm a worker, employee. So if previously I am free to go out, to go to work and then functioning well in my working environment, suddenly this crisis happened. So I cannot go to work freely. I cannot function the way I used to function. So this make us, our body, our system become shocked. We do not know how to react. No one give us the manual on how to respond appropriately according to the crisis. So our body needs some time to adjust. That's why if you can recall back at the earlier time of COVID hits Malaysia, there is a group of populations that hits immediately. They withdraw, they started to show exhibit symptoms of anxiety, depression, etc. So there's an increased pattern in terms of that. But others, towards the second cycle, the first cycle, they are okay. They are still resistant, they are still resilient towards the crisis. But in the second cycle, then pandemic hits them, the crisis hits them. So what does it mean? It means that every individual respond to the crisis differently. But since this is a crisis and it is a prolonged crisis that is happening now 2 years already in Malaysia and around the world, right? So eventually, one's mental health is going to be affected, be it whether the person's already pre-existing condition or not. So eventually it will have. So you need to differentiate. I think that we have two more experts here to talk about mental illness, right? But we do understand in general level, mental health and mental illness is different, although they share some similarities. Okay, so for mental health, every one of us could have mental health issue, but it needs certain criteria to be diagnosed as having mental illness. So semua orang exposed to being vulnerable. So another reason is that when pandemic hits us, it exposes us to more factors to become vulnerable. If before, like I said, we can escape, we have conflict with our spouse and then we can escape work or study or anything. If we have problem with our toxic parents, some of our students have this issue, they can escape, they can come to campus and live their life as free as possible. So when these are the vulnerable factors, so once pandemic hits, they exposed to these vulnerable factors more than they used to. But the coping mechanism limited. They cannot go out, they cannot, like I said, we advocates on healthy lifestyles, right? Okay, how you manage your stress? Maybe you can go out and jog, you can go brisk walking, but during pandemic time, you can't even go out and do brisk walking. So these actually take away the sense of control and eventually develop the sense of feeling hopeless. They cannot see the way out. Now we keep on hoping that, okay, this COVID will go and then the MCO after that, MCO being lifted up a bit and then suddenly we have EMCO or whatever lah kan, PKP,
Right?
yes. And then people started to lose their hope. Eventually now we see the light lah at the end of the tunnel. However, at that moment of time, imagine that you are in a very uncertain situation. So that exposes you to a lot of factors that affect your mental health. So the thing is, now with this pandemic, we learn how to respond to the emotional crisis better. So that's why when we are getting much more stable and we understand the whole dynamic of this pandemic, we learn how to respond in terms of emotional crisis, that okay, what we need to do first. It's okay if we exhibit the symptoms of anxiety because it's a normal response to a crisis. We need to be empathy to ourselves and not being too harsh. And then we need to take a step back. All of this, I think, I don't know lah, in my years of schools kan, high school or primary school, I was not being exposed on how to
Yeah,
regulate our mood.
definitely. It's like relearning ourselves, like
Yes.
being kind to ourselves and understanding the emotion itself, recognizing that this is fine. This is not, we are not, we are not okay, but this is okay. But it's just like we don't know to what extent it's not okay and okay, right?
Yes, definitely. So now that we know, it is very important for us to learn how to regulate our moods, how to identify our moods. So this is something that is not being taught at school level or even university pun. Kan? But somehow now that we learn, the university of the world is forcing us to learn how to regulate our mood by learning from this pandemic. So yes, that is the most obvious things that we can observe, the direct impact of the pandemics towards someone's mental health.
Thank you so much, Sister Masturah, for that. I mean, it should be another webinar about that. I'm so interested on that. All right. We're moving on to Dr. Lihanna. According to the National Mental Health Strategic Plan initiated by the current government, the Ministry of Health has been in collaboration with various ministries, including the Ministry of Education. So, how have the objectives of the National Mental Health Strategic Plan 2020-2025, as well as Sustainable Development Goals, we know IIUM is very famous for SDG, right? Affected the construction of policies to aid mental health during COVID-19 in IIUM?
All right, thank you again, Sister Shafika. Now, I know you have been talking about the National Strategic Plan for Mental Health, but let me introduce you to another one. I hope everybody's familiar with this. If you're not, then oh wait. As I am student, this is something that you should be. This is the Sejahtera Academic Framework. Okay, the term itself, if you see it, or if you hear the word SAF, okay, this is the Sejahtera Academic Framework. Now, this was actually endorsed in Senate in 2019. So you can see we actually started earlier, except the book itself came out early in February 20 this year. It started, the work for SAF started in 2019 and then endorsed in Senate in 2020. And then the book itself came out earlier this year. But it really encapsulates the things that we want for our students. We don't just want our students to go out and have a string of A's, but not become sejahtera. Okay, not because we want our students to, and I hope, inshallah, this is what you also want. You don't want to just have good grades and lots of money, but not be happy inside, not be useful, not just, I think you all do want to contribute to not just your personal life and the people around you, but to the community at large, right? So that is what SAF is about. We get everyone in the university to really move together forward, to want to move together forward, so that we can create this environment, this BR, that's going to help everyone, not just the students here, but staff to lecturers and also any staff, to really grow together, because we can only help others if we ourselves are sejahtera. Okay, if we feel good, then it's easier to help others. You need to take care of yourself first before you can take care of other people. Okay, and that is part of what it is for. This is also a reminder. SAF, the Sejahtera Academic Framework, is a reminder for lecturers that students are not just names and metric numbers to be graded. Okay, they're people, a human to, we can't mold you. Okay, it is lecturers are not superhumans who can mold, but we can facilitate, we can help, but that's the idea, because you're young adults. We're not talking about little children, not talking about school children. We're talking about young adults. So that's also a reminder for this. So this document is also a reminder for our for lecturers to really look at each and every one of you as individuals in your own right. Okay, but there is also the assumption that the students themselves also want to grow. That the students are not of the me, give it to me, but more of a, okay, what can I do? I want to grow, I want to be better. Okay, help me become better, and I will also help you become better. So that's the idea. That's generally the big picture. Okay, and that of the Sejahtera Academic Framework, which is also rooted in the university's mission and vision. So you can see there that as part of it, actually, then is the mental health, because again, you cannot be productive in the long run if you are not mentally healthy. Okay, and we look at as part of it also, one of the things that is the outgrowth of the staff is what we call the ihsan, the IIUM Haikal. Hold on a second. لأصحة العقلية النفسية. Okay, which is the Arabic for IIUM, framework for mental and spiritual well-being. Okay, so the idea there is that mental health, again, like what Sister Masturah said, is different from mental illness, and it's not just an absence of mental illness. Good mental health is really actually about being sejahtera, not just an absence of mental illness. Thank you, Azza. Okay, so so if you were to map that Sejahtera Academic Framework to the National Strategy Plan, is there. In fact, if we were going to be a little bit better, we're probably going to say it's a little more than the strategic planning, because we're not just talking about rehabilitation, we're talking about advocacy, we're talking about creating not just preventive, but also a promotion of a healthy lifestyle spiritually and in other aspects of life, inshallah.
All right. So, how have IIUM ensured that the student who are severely and have perhaps lost devices, internet connection, and even some lost house? So, how do we reach those students?
Okay, this is where it cannot be just a one agency reaching out. This is where we get together and we plan. If you actually a lot of students don't know this, but from the very beginning we have what we call the COVID-19 operation room. Okay, and there the major agencies are there. So during the earlier period of COVID-19, we actually meet every day, including the student union. Okay, they're part of that operation room. So, so that we can all work together to reach out to the students, because at different point in time, different issues and different needs arises. So we need to be able to move in quickly, like right now. Okay, which is the same thing in every semester during this time. I think CCSE will also tell you that there's a higher increase of students saying that they are stressed out, because we can see this is going to be week 12, where a lot of assignments are due. Okay, but we also do things. We work with the training of lecturers. We have the Center for Professional Development, and part of that is actually training our lecturers in terms of how to handle assignments. The kind of assignments. Now, we're treating you with kid gloves. No, it's still about challenging you people to grow, but really challenging in a way that is healthy, not in a way. So there has to be a lot of thought given to the assignments, the assessments. So we can, for example, there have been some lecturers who changed, okay, who adapted to the flat situation. Those of you who went out to do volunteer work, you're able to actually get bonus marks for that. There are some lecturers who do that, and under staff, actually, this flexibility, this empowerment is given to the lecturers. So these are some of the things that we do encourage people to do. And we work with impact. Just now, Sister Farhana talked about impact. Okay, we also, let's not forget our brothers and sisters in Kuantan, in Pago. So we work also with the Kuliah of Medicine, with the SASMAC, the hospital, our hospital. And we have also been in talk. CCSE is actually planning to come up with a module of training for lecturers also. So to enable them to at least be able to do some immediate, and definitely not therapy, but some skills. Okay, some skills to work with the students. So it's a constantly changing thing. Perhaps what we could probably do better is to publicize this more, but sometimes we get so busy with actually doing it that we really don't share as much about what we're doing with the larger community.
Thank you so much, Dr. Lihanna. I think I mean, it's opened my eyes in terms of like, I didn't know. I mean, not of all of the students. I think a lot of us thought that IIUM has left them behind, right? And our IIUM doesn't care about mental health, right? Because as you say, you were so focusing on the work, right? That there's a little progress updated to the students or to the university. So I hope people who attend this talk can spread out the words that actually IUM care to everyone, even lecturers, and because it's constantly changing now that we all of us are trying to understand this, right?
Yes.
Okay, so moving on to Sister Farhana. Are you there?
Yeah, I'm here.
Yeah. Okay.
Can you guys
So
still see my face? I feel like the internet connection
yeah,
is
I
quite
can see your glow
okay.
beautifully. Alright, so as a
Okay.
student, we know that you have a lot of responsibility toward yourself, your family, and your association. So, how you manage to juggle between these factors, especially during COVID-19?
Okay. All right. Thank you so much, Sister Shafika, for the question. I really like this question, but I also find it very difficult to answer because, to be honest, for me, there's no easy way to answer this. Because juggling a lot of things in a normal situation is already so difficult. But now we are juggling a lot of things in a COVID-19 situation. So the difficulty has like doubled, multiplied by a lot. Because there's chaos all over the place. People are um, I hope that situation's getting better now. But going back to the time when COVID-19 started happening, people are losing their job. People are losing their family, and students are struggling with online learning. Adapting, transitioning from physical learning and online learning is definitely not easy. Even until right now, it's still not easy. Some of us are still trying to adapt. But to answer your question, I think the beauty of struggle is that um, we can always try. We can have hope in trying to adapt in this situation and make things better. And I'm not perfect myself in juggling because I'm a human being, but the one thing that I do is that I have a lot of hope in things. I would say that I'm an optimistic person. Whenever like I embark on any journey, anything, any difficult situations, I try to think that it gets better. Um, just try to have I try to have hope that it gets better and it's gonna be rewarding and worth it at the end because I hold on to this. I hold on to the fact that God doesn't put us through situations where we cannot overcome. That's what gets me through COVID-19 and any other difficult situations. Um, and then to answer how we can try to manage things better, I am an on-campus student, so I guess I speak for students who are also on campus. Where when we are on campus, it's it's easier to get things done because you have your own space and your own time. And I know that you hear this a lot, but making schedules, arranging your priorities and managing your time is really, really important. I know that you hear this a lot. Okay, making schedule, manage your time, um, prioritize things, but they're very, very true. You need to do all this to like make sure that you have all your priorities taken care of. To ensure that you are taking care of yourself, your family, your friends, people that you are responsible for. Like for me, last time I was a chaplain, so I was pretty much responsible of the psychology students. Whatever like they had struggles or anything, I had to be present to make sure that their voices are heard. So you need to manage things well, and as someone who has a lot of things to do, I prioritize my notes and reminders a lot. I like to make lists and I prioritize things. Which one needs to be done as soon as possible. So you take your time, but make sure to also take your breaks in between. Take your breaks in between, or after a long day of doing work, don't forget to wind down, take some breaks, because you can't continuously do work. And I feel like a lot of our students are also doing that, because with a lot, and the problem is that sometimes they don't have a choice because there's a lot of academic workload, and there's a lot of responsibility, especially in COVID-19 situation right now. The pandemic, we're now in the endemic, COVID-19 endemic. um, the responsibilities are probably like double, because if you are at home, you have to take care of your parents, your siblings. You're no longer just focusing on your academic. You have other things to do. Some of the students even have to take up jobs to support themselves. I know my friends who have to take up jobs to support themselves because their parents cannot afford to pay for the tuition fees. So it's a struggle. It's definitely a struggle. But if you're at home and you find it difficult to manage your things, you try to, what I can suggest you to do is probably to communicate, because communication is very important. If you do not communicate and if you do not convey your feelings, they may not know what you're going through. Sometimes parents, for example, if you're studying, if you're doing online learning at home, parents, don't um, they just need to know that they just need you to tell them, if you are, probably you need some time to, you have an examination, for example, tomorrow, and you need some time to take a break and to study, and all that. You just need, sometimes they don't understand, but if you communicate with them and if you convey what exactly your situation is to them, and inshallah, they will understand it. So that's what I can suggest for students on off campus. I know it's difficult, but we will try our best to communicate. Let's just try our best to communicate. And then for managing your time and all that, make sure that you do not skip your meals. You are also as important as any other work you're doing, as any other assignment you're doing. Um, if you just simple things like eating, taking a walk, any quality time that you take for yourself is actually a good quality time for yourself. It's a break that you should be getting, because I feel like a lot of people I know, they do not take breaks, and that's why um, burnout happens. Sometimes we need to prioritize ourselves. Even I myself, I I am talking about eating meals a lot, because I used to be that person who didn't take meals. I am getting better now, but I used to be that person who would not take meals and would just focus on doing work. But you need to remember that if you're sick, then you can not do anything else. Nothing else can be done. So you need to take care of yourself. So yeah, don't forget to look after yourself. Try to manage things. Make schedules. I know it's something that you hear a lot, but it's actually very very true, and something that I've been practicing. And Alhamdulillah, I think if you like manage your time well, learn your priorities, then it gets better. I'm sure there are many. Yeah.
Sorry to interrupt. Just to make sure that we are at the right line. Okay, so first, fit your thoughts, right? You need to constantly remind yourself that you are doing great, and whatever you are facing, it will definitely get better, right?
Yeah.
Okay, so second is to stay organized. Is that correct? You need
Yes. Or
to
that's
list down
important.
your priorities. Okay. Next, you have the third one. Okay. Let me show my finger. Third one, communicate. You have to communicate with your friends or your family
Yes.
about your struggles, because otherwise they won't know.
Yeah.
And the last point is that you have to stay healthy. You have to take meals. You have to take break. So because what do we call it in Bahasa Melayu? Or there's a famous peribahasa, like the
What is it?
how, oh my god, like how our body is like connected to our mind.
Oh.
Oh my god, I always use that to goreng in my karangan. But I
Okay.
really cannot recall it, but okay, you guys can find it. I
I
think you
get the
guys got a
idea.
bit
I
of
get the
an
idea,
idea,
but I
right?
just can't recall either.
Badan cerdas, badan cerdas, minda
Minda cerdas.
cerdas. So like it's connected, right?
Yeah.
If you have a healthy body, then you have a healthy mind.
Yeah, that's
So
true.
make sure you guys practice the 4 tips from Sister Farhana, because I also do the same thing. Yeah, it works. Especially the first one. Whatever you tell yourself, You need to constantly remind yourself whatever you fits your thoughts. It's become what I remember. I attended this one talk therapy. My therapist said that whatever you fits your thought, even though you were unconscious about that, like let's say like you fail a test, and then you say to yourself, oh, I'm a useless, I'm a stupid person, even though you don't really mean it, but it stay in your mind. So be careful with whatever you feed your thoughts. All right, everyone, take note. Four tips from Shafika and Sister Fahana. All
Thank you
right.
so much, Afika, for summarizing that.
Thank you so much, Sister
Thank
Fahana.
you.
All right, we have to move on a little faster because we are running out of time. So, Miss Mastura, from a survey that we conducted before, 50.7% of university students stress and pressured because of the overload assignment. What is the best way or tips for students to manage their mental health in their studies, especially during COVID-19 and the recent event? And as we are slowly transitioning back to campus life, can you share with us?
Okay, most of my points already been shared by Farhana. Okay. No, just joking. All right. So I just want to add a few things lah, because when we talk about tips, the hacks, you know, everywhere you can just Google and you can like just a click away from the whole lot of list of tips on how to maintain your sanity towards this period of time. But to talk about reality, when Prof. Lihanna mentioned, okay, this at these weeks, CCSC is accepting a lot of cases. Me personally, because my unit is academic and training unit. Okay, if you go I Maklum and you find my name, you can see my specialty there, academic and training. So a lot of the students come to me for LOA, leave of absence. So to the point that I'm wondering, I at my room, like, what happened to our students? So there's a lot of application of LOA, and definitely you have to go through counseling sessions. That as you need to a report from us to process your application, but you need to bear in mind sometimes if your issue is not really related to psychological or mental health related, our report will be stating whatever that is happening in the session, lah, what you're trying to tell us. Okay. Um, to the point that the student would email us, I want to take LOA, please make our report. Please do our report. To that extent, that makes me wonder what happens to our students. Okay. So when we talk about mental health, I always focus on two components: reaching out and commitment. Very important. Reaching out is the first step. You need to be able uh, to free yourself from self-stigma or the society stigma to reach out for help. You have, there's a group of students ask me, is the service in CCSC free? And I was shocked because I've been working in IIUM for like almost 5 years, and IIM students should know that the service is free. Okay, so and other than CCSC, we have Impact, we have SiteStar, even under CCSC, we have our support group as well. So there's a lot of platforms that you can reach out, but sadly, because of stigma and the fear, people stop themselves from reaching out. Okay, so you need to go through the first stage first, reaching out. Like Farhana mentioned, communicate, try to express in an appropriate platform. Don't express to someone who you know clearly is going to judge you. You can identify, you have this tingling feeling like Spider-Man, you have this tingling feelings that, if you talk about your issue with this person, definitely the first thing that came out from their mouth is judgment. Okay, so avoid these people, right? So when you reach out, the second phase is commitment. That's why our session is not only we focus on how many numbers of new clients, but we also focus on how many follow-ups that we have. It shows that how we can retain the commitment of the client throughout the treatment process. or the therapy process. Because you need to know one issue, there's no one solution fits all. Every client is a new textbook to us. For example, maybe like Shafika and Aizat here, you might share the same issue. I give example lah, maybe Aizat put ada family issue and Shafika also family issue. Contoh, right? Both of you have similar issue, but it different to each respective person. That's why I say every client is a new textbook to us. So we need to have this commitment from clients so that we can follow through your progress, or if you regress, and you also can see whether you are progressing well or you started to like withdraw much more as compared to before you attend the therapy. If you withdraw more, then suddenly something is wrong lah with your therapist or counselor, kan? So you might want to change. Okay, so two things. We talk about how to make sure or how to maintain our mental health. In transitioning, first you need to eliminate self-stigma, number one, and reach out. And second, to be able to commit in whatever therapy process that you participate. Okay, jangan main celup-celup je. That is the thing, okay? Because commitment takes responsibility. Of course, when you communicate with your lecturer, right? Okay, madam, I have difficulties. I feel my counselor also validates that I have symptoms of anxiety. My clinical psychologist mentions that I have a symptom of anxiety. So this makes me feel much more difficult to focus in my class. Of course, number one, you already convey your problem. But what is your commitment to improve the situation? Is that when you throw the bomb and that's it? Remember, you're talking to a stranger, even though that your lecturer really loves you so much or you love your lecturer so much, but these two individuals are strangers by nature, okay? So if you drop the bomb and then you get help, that is when people see the commitments, and you also commit in yourself that, okay, I'm struggling now, but it's okay that I have this commitment and I will try the best I could. If my best is not the best to anyone else, and that is their problem, but I am giving my best to myself. So that is the commitment that we want to see in any types of sessions that the clients comes to us. Because no matter how small your progress is, that is a progress for us. Okay. Next, we've talked about emotional regulation, etc., etc. So when you transitioning back between online session and hybrid, like Prof. Lihanna mentioned, okay, it's good for IIUM actually. We have this soft landing now as compared to other university. IIUM gives soft landing. Before we transition 100% physical classes, we have this hybrid. So slowly, a few critical classes that need physical sessions, then they come first, and slowly you being introduced back. Because there is a study, some of you might do swimming here. I am not, but I learned this theory based on the, how the swimmers resurface, once they go down and then they resurface, there a retention, that water retention dekat atas tu, okay? There's a force. So you need to break through the force of that water force tadi tu so that you can breathe, so you can swim more, right? So same goes with us. We need to break through the tensions that already developed, because now we already adjusted an online platform and suddenly you need to socialize back. Nak buat kawan balik. So it can be a struggle to a certain people, because you imagine if your time when you were in first year, first semester, that was the first time MCO, you do not know how to communicate, how to socialize with your group mates, with your classmates. And now when you transitioning back to physical class, social factor can be one of the pulling trigger. Be very careful. So that is why it is very important for us individually to be mindful of our changes. Be it in terms of physical, like Farhana mentions, if you started to eat less or sleep more or eat extra more, changes, any type of changes you need to be aware, because our body is telling us that something is not right. Serious problem happen when we started to ignore all of these symptoms that our body shows us. We think that it's okay lah, push kan. Last burn out. So important, being mindful of our environment, reach out and commit in any types of therapy, even if you think that your issue is very, very small issue. But once you reach out, you get help, put commitment as long as you can. Stay there because there's people to support you. We are genuinely to want to help you, right? So that's my tips. And also work in team. Try to work in team. I know this is very difficult. But like Prof. Lihanna said, there's no one agency can solve everything. Even us at the different agency also, we learn how to work together so that we can have a better outcome. So as a student, although I understand and I know group assignment is the most difficult thing. If you have to choose between group assignment and individual assignment, you would prefer individual assignment. But in reality, our life, we need to work in team. So the key is to always negotiate the issue lah with your team. That's the tips that I can share with you, especially when you returning back. Cepat-cepat cari kawan. Right? Okay, that's all I think.
Thank you so much, Sister Masturah. Wait, I need to recap. First, we need to be mindful. Second, we need to reach out. And lastly, we need to stay committed with our therapy or any counseling session. Okay, moving on to Dr. Lihanna. Mental health issue will perhaps for a long time be a factor that university have to tackle, and student mental health play a great part in ensuring a healthy environment. This will definitely need the involvement of many institutions within a university, including student bodies, department office, lecturers, as well as individuals. So what do you propose should be the different what you propose should the different institution do from now on and in the future to aid students in battling mental health difficulties?
All right. Thank you, Sister Shabika. I will rephrase that and say, I am not proposing. This is what they have to do under the IIUM student mental health, IIUM mental health policy for students. So we have actually spelled out a lot of the things that each of these agencies have to do. Now, but students also need to know what is in there. Okay, so the idea of the IIM mental health policy for students, we also actually have a policy for staff also. Okay, so but let me focus today for students. The idea here is that we're not just going to be service providers, okay, but we would want students to really, it's not, how do you say it? So everybody has a role to play. I'm going to just share some of the things, okay, but this is also something that students need to understand. You cannot scream, I have mental health issues, don't make me do all these assignments. Don't make me take all these exams because I have a mental health issues. Well, you can't go to your lecturer screaming that, but what you can do instead, and under this policy, is first you go to CCSC. Okay, you go to CCSC, get registered get registered for mental health services. Okay, now who can have this? Now, so you then go in, you'd say, I want to be considered for mental health to get mental health services. This is different from the counseling session. This is a very specific that we call, and what CCSC is going to do then, CCSC is going to go through, the way that the disability services unit have these provisions for students who are disabled. So this is similar to that. So they will do screening to make sure that only students who really deserve it will get it, because there are a lot of things that we will actually we would like to offer students who have issues. Okay, so once you have that, then only you will be able to get things like, okay, let me just share just a few of the provisions that is available. Okay, for your exam, you can take special exam. Okay, you can also, the idea to actually register to this is for you to, for us to also know, okay, you also may have issues, so we can help with the mahala arrangement. You know, IHWC is also aware that there could be a special need in certain situations. Okay, so this is why we really encourage students to register, the ones who need to. Okay, we have academic concessions for acute mental disorders. For example, you can apply for a special exam. Okay, but again, don't go screaming to your lecturers and say, I have mental disorder, don't give me an exam. You need to go through CCSE first. Okay, and then you can actually in certain, if it's needed by the students, you may apply for access to a secluded writing venue. Okay, you can have a separate space. Okay, and perhaps also a longer time for your exam. You can also take leave of absence, of course, and then we also have the mahala people to be aware of it, so that you can have the access to the services if needed. Okay, and then so the IHWC will also be able to this, but all this of course is done with confidentiality. You register for that, and but no one else is supposed to know, and except if really needed. Okay, so it is to be confidential. In fact, we have our Ihsan Council who take care of all these difficult issues also that requires this interagency collaboration. So we have that Ihsan Council. But even that council, everyone in that council has to sign a non-disclosure agreement first before they can actually attend the meeting, because nothing that identifies students can be taken out of that meeting. So we're very, very careful about all these things, so those are just some of the things that we have in the IIUM mental health policy for students. It's actually available for everybody to read, so that you know what are the accommodations, what are the provisions that are available to you. Okay, but we also do encourage student activities that, so not everybody really needs that care thing. A lot of us need also just the preventive, okay, and the promotion of good well-being. So these are also things that's why the sports center is also part of the mental health committee, so that we can also create an environment where it's healthy, like what Shafika said just now lah, kan? Badan cergas, minda cerdas. Okay.
Cerdas, yeah.
Yeah. All right. But the minda here is not just the cognitive mind, but it's really the mental well-being, inshallah. So yes. And if you say, but we don't see it, because again, let me just remind you, this is new. This has just been endorsed this year. So a lot of things are being put in place. So, if you think there are things that need to be improved, just go talk to any of the agencies. And right now, the chair of the council is actually, right now is chaired. I know everyone thinks it is chaired by the Deputy Rector Student Development, but no. Right now it's being chaired by the Deputy Rector Academic. And then we're going to actually rotate the chairmanship, because mental health is not just the purview of any one office, but it's the responsibility for everyone. So everyone in the top management will actually be chairing that council one time or another because it's everybody's responsibility. Thank you.
All right, thank you so much, Dr. Lihanna. And now that we have ended our session, I would like to express a million thanks to all the panelists for the fruitful discussion we have had so far, and to all the listeners that are still in. Now we are moving to the Q&A session. I would like to open the floor for a Q&A session. For those who have any question, please raise your hand and we will call you by name, which then you can turn on your mic and ask away. Or if you are shy, you can just put your question in the chat box and I will read your question. Yeah, please go on. And in the interest of the time, we can only allow 3 questions during this time. So yeah, any question? Is there anyone who would like to ask question? Is there anything in chat box? Wait, I'm checking the chat box. No, no questions so far. I think is asking this question to Sister Farhana, right? Okay, so I'm passing this question to Sister Farhana. What do you propose the university should or could do in aiding the students during the process of transitioning, as well as what is SAGSTA doing to help the students to achieve this?
Okay, thank you so much, Sister Shafika, for reading the question, and Sister Azatul for asking the question. So, what do I propose the university should do or could do in aiding the students? I think first and foremost, um, the university should be more connected and engaged with the students, with the grassroots community, and listen what is the root problem, what is going on, what is the concern or help that is needed from the students. You know, we have so many surveys. Actually, we have so many surveys. Every time something happens, we have a lot of surveys. Surveys that are conducted by IUMSU, Student Union, or Kuliah-based societies, or department-based societies, and surveys are good. I did not oppose the surveys at all because, you know, the findings and data are very important for the top management and high authorities to know what exactly is going on in the grassroots community and how they can help the grassroots community. But what is the action taken following the data and the findings? And I feel like uh, uh, universities should be more connected. And I can give an example of the recent surveys that were conducted, the flood, the flood disaster that happened recently that affected many of our students. I am so sorry in advance if anyone does not agree with me, but I think that we should have been given the break, not just 2 days, but at least 5 days for the students who are affected to to compose themselves to recover because they have lost so many things, and I think it has badly affected many students. This time it doesn't happen in just one state, but it happened in many states. And even for those who are not affected, um, they are going out to volunteer. Just yesterday, I think was it yesterday or 2 days ago, every day there are buses departing from IUM. You can see if you are on campus, you can see in the morning there are many buses departing from IUM as student volunteers are deployed to many various places which are affected by the flood. I think on Saturday alone there were about 20 buses. So 20 buses 40 students, there's at least 800 student volunteers. So what the university should do is probably be more connected and listen to the grassroots community. And one of the good things, I think Dr. Lihanna has mentioned earlier about the revision of minimum academic load. So this is something that is good. The university has done that is good. They heard that the students are struggling with academic workload, especially during the times of COVID, where there are many factors. Now it's not just about studying, but there are many factors affecting your academic performance. So the university has revised the minimum academic load from 15 credit hours to 12 credit hours, and this has definitely helped the students who are struggling academically. Because academic struggles, mental health issues, it is affected by many things, including academic struggles. So this is what I think the university should be doing. And what SEXTA, there's a question about SEXTA as well, right? I think SEXTA, as the student representatives, we should also, although I'm no longer in SEXTA, but last time I was in SEXTA, we should also be as the student representatives, as the medium or the liaison between the students and the higher authorities, the top management, especially in the department. I think we should always be engaged also with the students and be well aware of the issues, the things that are going on around with our students, so that we can amplify their voices. Because students, they have issues, but sometimes they don't know how to reach out to their lecturers. So which is why the SAISTA, as the student body, they should be responsible to help amplify their voices or guide the students on how they can talk to their lecturer. For example, the thing is, I think I also mentioned about communication earlier. Communication is very important. We cannot just stay silent and not say what we are struggling with. We need to communicate, and that's how the other party can help us. Without communicating, then how are they going to know what our struggles is? So I think that's what SEXTA should be doing, and what SEXTA is doing, amplifying voices of our students, and ensuring that their concerns are conveyed to the high authorities. Thank you.
Thank you so much, Mr. Farhana, for answering the question. The next two questions I will direct it to Sister Masturah. The first question is that what is your opinion when somebody says that the one who has mental health problems sometimes just pretend or she just want attention from the public? The second question, how serious is mental illness compared to other chronic diseases such as cancer?
Okay, before I respond, I think I want to pass the baton for the second question to Prof. Lihanna.
All right, sure.
All right. So I respond to the first question. Now, people have this kind of response because although mental health literacy in Malaysia, we can see some progress in it, but I can safely say that the mental health literacy is progressing well in Lembah Kelang or at the center. But if we move outside a bit, like I'm from Johor, um, I do my own survey for counselling services and how they responded to counselling services in Johor. Not as positive as how we see or we can see in Lembah Kelang or the center area. Okay, so the thing is, we need to advocate more on mental health literacy in a proper way. We don't sugarcoat it. We don't talk, okay, mental health is like this and like this, or mental illness is like that. We need to state the fact so that people are more literate about it. So once we advocate about what is mental health, and of course after that, what need to be done. And of course, like accessibility mentioned by Sister Farhana. One of the things that make things worse during pandemic is most of our clients, the accessibility to their own psychiatrists being cut. So they cannot access the help. So this situation makes more people who do not know or who do not aware about what is mental health, they have these assumptions. And it is easy for us to put label, kan? It's very easy. Like, oh, okay, you just acting out because you want attention. So it's easy because we don't have to think beyond that. You know? when we are actually listening, or like listening by heart listening, Sister Farna mentioned just now, or attentive listening or therapeutic listening, whatever we want to put name about it, okay, we need to put effort, energy to understand beyond what people demonstrate or what people show, because you know that anything that we exhibit outside might be a persona that we put up. Okay, so to think beyond that need a heart that is willing to understand, and that requires energy, it requires effort. So that's why some people thinks that it is easy to put label that, oh okay, you just acting out because you want attention. But if we can add a little bit further or think a little bit further than that, beyond than that, maybe, okay, he or she might want attention, but what leads to the attention seeking behavior, if so called you want to label them as attention seeker, right? So what leads to that? So just add another question. So that is my opinion. Because of number one, mental health literacy, we still need to work on it. We still need to advocate on it. At the same time, we need to expand accessibility for mental health issue. Early intervention is very, very important. Mm. So that is my response to that. So I pass the baton to Prof. Lihanna because I think she's more expert to answer that.
Which question?
Okay, I will read that question for you, Prof. Lihanna. Okay. The question is that how serious is mental illness compared to other chronic diseases such as cancer? Ooh, such a hard question.
As serious, if it depends. We also know that there's a whole spectrum of mental illness, just like there's a whole spectrum of cancer. And some cancer are more easily treatable than others. Mental illness is also that way. Okay, so, and just because it's mental and not physical like cancer doesn't make it any less worrying, doesn't make it any less serious than a physical illness. I think that is something that forum like this will be able to help others understand. Just because we don't understand it doesn't mean that it's not there, doesn't mean that it's not serious.
Right, thank you so much. And the last question. What would you say if someone said that mental problems are because of your faith is weak? Uh, I heard this so many times. I too. Me too. Cakap lemah iman kan, tak sembahyang, tak mengaji, yang macam-macam lah.
Then they would want to go back and see that some of our Muslim scholars have actually been, if we look at this one, there are indicators that they may also have had some form of mental illness. Has nothing to do with that. This goes back to what Sister Masturah said just now, about people being judgmental. But let's not also just judge them for being judgmental. Let's just say that perhaps this is why we need to have more mental health literacy. We need to have a lot more of this forum where we can discuss and look at issues like this and understand a little bit. If you want to look up a little bit more, you can also read the Miasa, which IIUM under CCSC is a part of the advocacy group of Miasa. So you can also get involved with them. If you don't want to get involved on campus, you can get involved with them by
Alright. Thank you so much, both no, Sister Farhana and also Dr. Lihanna and also Sister Masturah. So now we are moving to before that I need to declare the Q&A session is now closed. If you have questions you'd like to ask, do email us, DM us, or hit any of committee members in any afterwards, because I'm sure there's a lot of other questions. Next, we are going to move on the exciting part, photography session. Before we finish, I would like to ask all the listeners to turn on your video if you may, if you want to, so that we can have a little photography session. And then I will now pass this photography session to Sister Iza. Sister Iza, are you here?
Sister Alia, by the way.
Oh, yeah, okay. Sister Alia.
Yeah.
Sorry, in here it says Sister Iza. Okay, Sister Alia, whenever you are ready. Okay, the floor is yours.
Okay, so I would really happy and appreciate if you guys can turn on your camera and take the picture together. I will start snapping if you guys are already okay.
Sekejap lagi saya.
Okay, smile guys. 1, 2, 3. One more, one more. One, two, three. Okay. Okay, thank you everyone. So I'll pass the floor back to Mrs. Alicia.
All right, thank you so much. Our team has sent a feedback form in the chat already. Is it? Is there feedback? Oh, not yet. Anyone, please send the link. Okay, we
I
will.
already sent it, but I will resend it back. Okay, hold on.
Okay, great, my brother Isaac. Thank you so much. Yeah, there you go. Okay, we have sent a feedback form in the chat. We would appreciate it if everyone here took 1 minute to fill in the feedback form so that we can improve in later future. Okay, so while we are on that, I would like to thank you, Dr. Lihanna, Miss Farhana, and Miss Masturah for being the light for our fellow listeners today. And we truly appreciate it. Alongside this, we'd like to also thank the listeners for joining us today. Thank you so much. It has been our pleasure hosting the What Has IIUM Done to Manage Students' Mental Health, and I hope you guys can agree with me that indeed IIUM has done a lot, right? But there is a lot more to do, inshallah, in future. As a representative for the committee, I would like to apologize for any shortcoming or flaws to panelists and also to the listeners. I hope everyone gained beneficial insight today and had fun being with me today. With that, for the Muslim, let us end our program with Tasbih Kafarah and Surah Al-As.